Assalamualaikum. Assalamualaikum. My name is Faizan Salim, roll number 191. In this presentation, I, along with my batchmates of batch 7, will present our research article. The title of our research is selected using finite criteria is Quality of Life in Alzheimer's Dementia and its Caregiving in Southeast Asia, a systematic literature review. I will present extract of a research article. Rest of the article will be presented by other members of my batch. The abstract of our article includes introduction, methods, results, conclusions, and keywords. First of all, I will briefly introduce our study. Alzheimer's disease is a brain disorder characterized by dementia, having several adverse consequences for quality of life. We conducted systematic review of the literature to study overall quality of life of patients and their caregivers and caregiving of this dementia in Southeast Asia. Regarding methods, PRISMA guidelines were followed throughout the course of our study. We conducted systematic review of full-text articles which addressed quality of life in patients with Alzheimer's disease, published in English from January 2000 to 8 September 2022. We used PubMed, Google Scholar, PsycInfo, and ResearchGate to search research papers. The search keywords included quality of life, QOL, Alzheimer's disease, Alzheimer's dementia, and Southeast Asia. Quality of the studies was assessed by using Joanna Briggs Institute (JBI) critical appraisal tool. Studies with similar characteristics were grouped together and studies findings were summarized. Our study found that the quality of life of patients with Alzheimer's dementia is influenced by multiple factors. There exists a positive correlation between quality of Alzheimer's dementia patients' life and their caregivers. Mean patient-rated quality of life was found to be higher than proxy-rated quality of life. Severity of disease had negative influence. Satisfaction of relationship with caretaker showed positive influence. Caregivers' quality of life was affected by carers' age, education, sex, relationship with patient, income, and underlying diseases. Decreased disease awareness, late diagnosis, inadequate caregiving facilities, and lack of specialist training are big hurdles in improving quality of life of said patients. Our study concluded that there is an unignorable research world related to quality of life of dementia patients in Southeast Asia, which presses on need to explore various health aspects relevant to it. Moreover, more investment in dementia care provision, dementia-specific research fields, and dementia specialist training should be made. That was all about abstract. Now Abdullah Mahmood will present the introduction of our study.
Assalamu alaikum. My name is Abdullah Mahmood, roll number 194, and I am going to present the introduction of our research. For introduction, first of all, I am going to tell you about Alzheimer's disease. Alzheimer's disease is one of the 10 most burdensome conditions for older people worldwide, with over 60 million people living with it as of 2020. The total healthcare cost for the treatment of Alzheimer's disease in 2020 is estimated at $305 billion, with the cost expected to increase to more than $1 trillion as the population ages. It is a brain disorder that deteriorates memory, cognition, behavior, and eventually the ability to perform daily tasks. Pathogenesis is associated with extracellular aggregates of amyloid beta plaques and intracellular neurofibrillary tangles made of hyperphosphorylated tau protein in cortical and limbic areas of the human brain. In mild Alzheimer's disease, people suffer memory and personality changes. But as the disease progresses, they face difficulty in language control, reasoning, sensory processing, recognizing family members, and ultimately making patient bedridden. Although the number of Alzheimer's patients is increasing day by day, there is a lack of effective single target FDA approved treatment. Enhancing and maintaining quality of life in persons with dementia is thus a major priority in dementia care. Quality of life has emerged as an important outcome measure of dementia drug guidelines. QOL has become a very important political issue insofar so it can be used to justify healthcare costs directed toward ameliorating the effects of dementia. Quality of life encompasses both objective elements such as healthcare and functional abilities and subjective elements such as perceived health and satisfaction. Lawton's model has been the most influential, and it comprises four domains that contribute to the quality of life. Number one is behavioral competence. Number two is psychological well-being. Number third is objective environment. And number four is self-perceived quality of life. With particular reference to Alzheimer's disease, quality of life scale assessment by patient might not be reliable owing to deficit in their memory, insight, communication, and judgment. However, the assessment of quality of life by proxy responders, that includes caregivers and family members, are liable to be affected by their and not the patient themselves' mood, belief, and expectations. An optical method to assess the quality of life Alzheimer disease subjects may therefore be based on the assessment of both the caregiver and the patient responses. The Loxon Quality of Life and Alzheimer disease scale, which is comprised of 13 items, which include physical health, energy, mood, living situation, memory, family, marriage, friends, self, ability to do chores, and fun, is most frequently used. Study has shown that depression in patients of Alzheimer disease adversely affects performance of their daily life activities and cognitive abilities, ultimately leading to lower quality of life. Psychological morbidity and mood factor also have shown to influence quality of life. In contrary to that, social activities and good family functioning and interpersonal relations are related to better quality of life. Current prevalence of dementia in Southeast Asia is 5%, out of which Alzheimer disease accounts for 59.8%. Point of point of concern is further increase in these numbers in low and middle income countries and scanty knowledge about existing post-diagnostic care and support. The number of researchers assessing the quality of life in Alzheimer's patients is China, Thailand, Malaysia, Philippines, and Singapore provide limited data with huge variability and discrepancies, making it substantial to explore and analyze current data qualitatively. The aim of this study is to present an overall picture of quality of life in Alzheimer's patients and their caregivers in Southeast Asia, so that this knowledge may be used by healthcare providers, researchers, and policymakers for better healthcare provision for Alzheimer's patients in this region. Thank you. The the other portion will be presented by the next speaker. Thank you.
Assalamu alaikum. This is Visma Akram, roll number 40, and I'll be presenting the methods used in our study. Starting with the strategy, this is a systematic review conducted in accordance with the PRISMA guidelines and uh, uh, and the studies including in this review were taken from PubMed, Google Scholar, PsycInfo, and ResearchGate. These databases were thoroughly searched for publication from January 2000 till 8 September 2022. And along with these studies, we also check for the reference for the cited out by options in the study, so that there is no study left uh, by mistake or anything. Our selection criteria is that my two bestmates, Basla and Bisal, screen the studies by reading title and abstract based on the following criteria. Our study population include all those patients which have a diagnosis of Alzheimer patients, irrespective of their severity and irrespective of the age at presentation, as well as their caregivers. Study that use validated scales for measurement of QOL were labeled eligible for the criteria. All the study populations must be the residents of the Southeast Asia, and the exclusion criteria includes study which didn't mention any validated tool for QOL assessment in Alzheimer patients and caregivers. Case reports, systematic reviews, meta-analysis were excluded, and इसके अलावा studies that describe forms of dementia other than that of Alzheimer's disease, RCTs, or experimental study were not included in the studies, and abstract studies whose full text wasn't available were not excluded in the study. Data was extracted. Data extraction 33 studies were found to be eligible by in the full text articles, which were reviewed by myself and Faizan. Disagreements were resolved via negotiation with Bisal, and following the relevant data were were extracted in the form of Excel spreadsheet, which included the title, authors, study design, study sample, mean age of participants, scales used for QOL assessment, and caregivers, cognitive assessment tools, main finding and limitations. And then we group the study with similar categories into different categories to make our literature more organized. And quality assessment, all the studies were reviewed according to JBI critical appraisal tool for cross-sectional studies, so that there is no study that was whose quality was not assured. And this is rest of the presentation will be done by the Ghulam Murtaza. Thanks.
Assalamualaikum. I'm Ghulam Murtaza, roll number 193. I'll be summarizing flow diagram. We conducted a review in accordance with PRISMA guideline. PRISMA flow diagram is shown in the slide. Talking about search strategy, we identified records from 3 databases: PubMed 456, Google Scholar 17,400, and PsycInfo 15. So we had a total of 17,871 records. After removing duplicate records, we were left with 17,400 records for screening. We used EndNote as a reference manager. Screening was done first on the basis of title and abstracts, and 17,356 records were excluded. 36 reports were sought for retrieval, and we got 30 reports in full text form, which were further assessed for eligibility after reviewing. 12 reports were excluded because 6 of them were clinical trials. 3 in 3 region was not Southeast Asia, and 2 did not include measure of quality of life, and 1 was protocol study. So we finally had 18 studies that met our inclusion criteria for review. Over to the next one.
Assalamu alaikum. My name is Aima Ayub, roll number 37. I will be presenting results of literature review. The initial research yielded 17,871 results, out of which 471 duplicates were removed. After screening for titles, 36 articles were sought out. Out of 36 articles, we only retrieved 30 articles. Then, after further assessing the eligibility criteria and our inclusion criteria, we have only 18 studies that met our criterion. Quality appraisal. On JBI checklist, that is for the cross-sectional study assessment, 9 studies scored 8 points. 8 studies scored 8 points, 9 studies scored 6 points, 1 study got 5 points. Now the skills used for QOL assessment. Among all the skills that are used, QOL AD scale was more frequently used, and this is adapted in Malaya and Thai languages. Other skills that are used are WHO QOL 8, Euro QOL 5D. And the severity of the dementia is assessed by MMSE, that is mini mental state examination, NPI, Bristol activities of daily living skill, and DAD. WHO QOL BREF scale was most commonly used, that is used in evaluating the caregiver's quality of life. Now to the next presenter.
Assalamu alaikum. My name is Misal Nasir, and I will be presenting the factors which affect the quality of life of Alzheimer's patients. So, after thoroughly doing the literature search, we found out that there were 5 main factors which were influencing the quality of life of Alzheimer's patients. The first one was the quality of life of caregivers. A positive correlation was found between the quality of life of Alzheimer's patients and their caregivers, and it was associated in the environmental, social, physical, and psychological domains of their health. It was found that the physical and social relationship domain of caregivers' quality of life had a strong effect on the patient's cognitive level. As the caregiver is only the sole help for the patients of Alzheimer's dementia, so any strain on the health of caregiver can have a negative impact on the health of patient. So the second factor found to be affecting the quality of life of Alzheimer's patients was the severity of disease. So in Alzheimer's disease, the severity is assessed via 3 domains. The functional domain, which is measured by disability agreement for dementia, the cognitive domain, which is measured by mini mental state examination, and the behavioral domain, which is measured by neuropsychiatric inventory. It was found that the level of cognitive impairment of the patients is one of the major predictors which leads to a worsening of quality of life. Now, the third important factor which affected the quality of life in these patients was the medication adherence status. The data showed that the prevalence of non-adherence in these patients, which was determined by the Malaysian Medication Adherence Scale and the medication possession ratio, was 69.2%. Most common reasons listed for not taking the medicine was forgetfulness and difficulty in taking medicine. Patients with adherence to medication were sure to have an improved quality of life. Now, the fourth factor was depression. Previous literature showed that depression in the patients of Alzheimer's dementia negatively influences their quality of life. However, in our literature search, no evidentiary support was found that depression was a significant determinant of quality of life in these patients. Other factors which were found to be influencing the quality of life of these patients was the satisfaction of relationship with children, friends, relatives, as well as the level of social activities, and they all were found to be positively influencing the quality of life. Now, the next presenter will present the next section.
Assalamu alaikum. I am Basler Rafiq, roll number 38. In continuation with research results, I am going to discuss caregiving in Alzheimer's disease. Diagnosis of Alzheimer's disease and dementia in general is mostly by chance during consultations with general physicians or investigations for some other disease. Post-diagnostic treatment was majorly based on pharmacological approach. Since it was costly, lesser families went ahead with drug-based treatment. Other than medical treatment, counseling of family members proved to be significant in management of the disease. It is fairly logical that diagnosis and prognosis of Alzheimer's disease would depend upon caregivers' level of awareness. In Southeast Asia, level of awareness was highest in Philippines, followed by Singapore and Thailand. Article which used Zared caregiver burden interview clearly showed role of patient factors like old male with low scores on mini mental state exam and high clinical dementia rating resulted in greater burden for female caregivers. Next is quality of life of caregivers. 7 included research articles showed that improved quality of life of caregivers resulted in higher quality of patient. So this is a two-way street. Improved quality of life of caregiver will improve quality of life of the patient. Secondly, there was higher strain in younger children of patients and poorer quality of life of female caregivers. Then low family income also negatively impacted caregivers' quality of life. Thesis conducted in Vietnam showed variations in psychological and environmental domains or WHO QOL brief scale in contrast to physical domains. Table on the right half of the slide shows domains and subdomains of WHO QOL brief scale. Then an important factor for quality of life of caregivers was the coping strategies used by them. Avoidance negatively impacted while reframing and passive appraisal were found to be effective. Next section is self-rated versus proxy-rated quality of life assessment. Questionnaires answered by patient himself showed higher scores than by caregiver or some other relative, which also depended on patient's level of education and severity of his neuropsychiatric symptoms. Self-rated quality of life was found to be poorer in depressed patients and patients who were provided care by other than their relatives, spouse or adult children. Then our study also included a study which studied quality of life of Alzheimer's disease patients during COVID-19 pandemic, which clearly showed poor to fair quality of life during the pandemic due to financial and other factors. Thank you.
Assalamu alaikum. I am Bisma Qureshi and I will be presenting the discussion section. Quality of life is the main determinant of effective dementia treatment and its betterment plays an important role in care provision. Important aspects included are as various scales are identified which assess the quality of life in Alzheimer's disease patients as well as caregivers. Most common tool is QOL-AD. It includes 13 items which measure quality of life. These are physical health, energy, mood, living situation, memory, family, marriage, friends, self as a whole, ability to do chores, things for fun, money, and life. It is less time consuming, which takes only 15 to 20 minutes and can be used in all settings and levels of severity of disease. EQ50 was used by two studies for quality of life. It is non disease specific and uses five dimensions for describing QOL: mobility, self care, usual activities, pain or discomfort, anxiety or depression. Moving on to measures for assessing severity of disease. Mini mental state examination, a 30 score instrument for cognitive domain only. Other indicators, for example, NPI, DAD, Bristol activities of daily living scale, were also included in some studies. Since quality of life of caregivers is as equally important as that of patients, so WHO QOL scale's brief version was the most commonly used tool for its assessment. It covers physical, social, psychological, and environmental domains of life for measuring quality of life. Following factors were found to influence the quality of life of Alzheimer patients. It was found to be positively related to physical, social, environmental, and psychological domains. Appropriate care facilities decrease anxiety, depression, and neuropsychiatric symptoms and improve QOL. Good relations with family members and being socially active has also improving effect. Medication compliance and adherence was also found to be positively correlated. Depression adversely affects quality of life, though any study included could not find the effect of depression on QOL of Alzheimer patients. Home care on institutional settings has also found to be affecting. And lastly, the huge pandemic COVID-19 was shown to lower the quality of life of Alzheimer patients. Thank you. That's all from my side. Moving on to the next presenter.
Assalamu alaikum. My name is Gufran Kamar, and I'm going to present you the discussion about our research. Factors influencing the quality of life of caregivers. The average quality of life of caregivers of patients of Alzheimer's disease was found to be less than that of caregivers of people without dementia. Changes in behavior of people with dementia, their loss of ability to communicate, and functional deterioration lead to decline in caregivers' quality of life. Due to burden of caregiving, most of caregivers were found unable to perform activities of their daily living. Quality of life was lower in those caregivers with low financial and social support in comparison to those with high social support. Careers, age, sex, level of strain, family income, caregivers' education, relationship with patient, duration, underlying caregivers' disease were other factors affecting quality of life of caregivers. Situation of Alzheimer's dementia and dementia caregiving facilities in Southeast Asia. A lack of public awareness was found in Malaysia. Less number of specialist care services were available, with referral mainly to geriatricians or psychiatrists that were available only in major urban care settings and hospitals. Infrastructure and workforce capacity for dementia care provision was also insufficient in Malaysia. Data about dementia care provision in other countries of this region is lacking. Report of Lancet shows that mental health has been a low priority in this region due to lack of attention and investment. Limitations. It includes studies only from PubMed, PsycInfo, Google Scholar, ResearchGate. We do not have access to other databases like Scopus, MBBS, and Cochrane Library. Data published in languages other than English, grey literature, and conference papers were also not searched for. Each tool measures somewhat different domains of quality of life. Use of variety of tools can lead to variation in QOL scores among different studies, making it difficult to compare results. Though the tools used in all studies, the tools used were valid and reliable. Thank you.
As there's some network issue, so I will carry on with the conclusion. So our review has summarized overall quality of life of Alzheimer's dementia patients and their caregivers in Southeast Asia. Different scales used for its assessment, factors influencing it, and the caregiving provided in this geographic region have also been described. There exists gap in research in this region related to the effect of dementia on quality of life in different severity stages and more aspects of physical, environmental, social, and psychological health that can affect the quality of life. So that should be explored further. And more investment in the dementia care provision, dementia specific research arenas, and dementia specialist training are proposed to be of utmost importance to improve overall quality of life of these patients and their caregivers in this region. Thank you. So, our